Chris, you authored an article that appeared in the journal Burns, and it was based on a clinical study that examined the efficacy of the DeepView burn device. You also have specialist training and experience in burn management on at least 3 continents. So with your experience and background, what are some of the shortcomings of other imaging devices that are out there?
So laser Doppler has, in my experience, been the mainstay for objective burn depth assessment for the last 20 years. It's certainly in use in the UK. It was in use in Australia when I was out there. But the hardware and functionality of the system has remained the same. So the laser Doppler provides a heat map output that requires some experience to interpret, and that's compared to DeepView's very binary output. I think the biggest shortcoming, in my opinion, is the portability and size of laser Doppler, which limits its application in a very busy adult and pediatric service. It's incredibly difficult or even impossible to move the device to other wards or to the operating theatre. We have to take patients to it. The benefit of DeepView is it's quite the opposite. We take it to the patient, and it makes the whole patient experience a lot more palatable when they've been brought in for potentially devastating injuries.
And you mentioned that LDI or laser Doppler imaging requires some training as well as being unwieldy. What kind of training is required to successfully use the DeepView device?
So the training is minimal, to be honest. The user interface for logging patients is very self-explanatory. It's easy via touchscreen. The device head is light. The most important thing to ensure is that it's the correct distance from the patient when you're taking the photo, which is easy to know as the distance gauge light turns green. And once the image has been captured, which is as easy as taking a photo on your iPhone, the wound healing algorithm can be running in the background while the dressing is applied. So all of our nurses, which are of varying seniority, age, and technophobic abilities, have used it without any problems, and the feedback from them has been really good.
And then, of course, there's the AI aspect to the device. What role does our artificial intelligence play in improving the device's outputs?
So the deep learning within the device has been taught using gold standard burn assessment techniques. So there was a cohort of US burn centers, and the directors of those have evaluated photographs and compared it with burn wound biopsies, so histology, and that's allowed both the histological and clinical benchmark to be established as part of the truthing process. And my understanding is that this now forms the wound healing algorithm within the device in conjunction with the multispectral data from the wound that it's picking up. And with each iteration of the device, the AI is refined and will have been trained using new wound data and potentially allow more functionality.
Yeah, it almost sounds like as things evolve and more data is input, that it actually could improve its accuracy. So that takes me to my next question, which is about the evolution of the technology. As I understand it right now, it's only used for thermal burns. Could it be used for other types of burns as well, such as chemical burns, and then also maybe outside of the burn sphere? What other applications could this be used for?
So you're right, at present it's not validated for use in certain anatomical sites due to a paucity of data, so hands, feet and faces are excluded. We are not yet allowed to use it in children, and certain burns like chemical, electrical, which are very nuanced and different to a standard flame burn or scald. But there's ongoing research to open up these areas in the near future. I think the application for use in kids in particular is really exciting, as we know that the risk of hypertrophic scarring is higher in children. Therefore, we aim to get them healed even sooner than in adults. So early and accurate depth assessment will be really advantageous for us in helping our assessment and reassuring parents. I hope that long term it's going to be validated for non-thermal burns, but that will require some work. In terms of broader picture, could this technology be adapted to assess other areas of plastic surgery? There's a lot of interest at the moment in terms of free flap monitoring, intraoperative flap perfusion. Could this be used as an adjunct with indocyanine green to monitor tissue perfusion? I don't know, but I think it would be a really exciting thing to look at, whether we can join 2 of the cutting edge technologies and see if they work together.